Hey guys, Dr. Ben here, Functional Medicine Centers, and welcome. Hope you're having a great day. So excited to talk to you today about some things that you can start looking at in your life. A lot of you or your loved ones are taking these medications, and I want to go over exactly what you need to be looking for and why it is such a concern. So again, I'm Dr. Ben Galliard. I'm in Fort Collins, Colorado. I am the CEO and founder of the Functional Medicine Centers. We have our office here. We have an office in Phoenix, Arizona. Functional medicine, we love getting to the underlying why. Why is the body having problems? And also, that is where this comes into play with these medications, because most of these medications that we're going to be talking today are about covering up symptoms, when in reality, we need to fix the underlying problems. And so if we were using our body's ability to heal and using the body to its best of its potential, we wouldn't need these medications and thus have that potential for dementia, for neurological degeneration. So welcome everybody out there. Julie, good to see you. Go ahead and put down where you're watching in from. We love to see where everybody's calling in from. We get people all over the world, so it's awesome to see that. So again, when we start talking about a certain class of medications, this is the anticholinergics, and I'll put that word down below, but it's basically a lot of different drugs that are used for various things. And when I go through this list, you'll be like, man, I did one of those. I know somebody that did that. And these drugs have been shown, many studies, to be able to cause neurological degeneration. In 2015, there was a study done at the University of Washington, and they were actually looking at sleep aids and fever medications, hay fever medications, that were going to contribute to this neurological degeneration. In the Journal of American Medical Association, their neurology division, they showed that this study at the Indiana University School of Medicine, that they were able to look at the brain scan and PET scan and see neurological degeneration as people were taking these classes of drugs. So let's jump into it, give you some ideas of which drugs are causing the problems and what you can do as a healthy, natural alternative to taking that medication. So number one is incontinence drugs. This is very common, way more common than you'd think about. If you look at Depends, you look at all the material that's bought out there for incontinence. That's where we're having bladder leakage, where we're urinating without trying to, etc. So the incontinence drugs, any of those, we know that they are going to contribute to neurological degeneration, potentially dementia. So what can we do instead? Pelvic floor exercises, Kegel exercises, which is basically that training of tightening. When you are going to the bathroom, look it up on just Google Kegel exercises. Those are great. Bladder training, where you actually start when you're really feeling that urge to go to the bathroom, hold it, wait another 10 minutes, see if you can start training that bladder to not go as frequently. Another one is muscle relaxants. So a lot of people are taking muscle relaxants in this country. They have lots of pain, they have lots of muscle tightness. Everybody's at their computer typing away, they get tight shoulders, tight low back, all these different things. Muscle relaxants are another class of drugs that are going to contribute to neurological degeneration and dementia. And so what can we do instead? Research has shown that massage therapy and taking magnesium, Epsom salt baths are all going to be great things for muscle relaxation. Narcotic painkillers. This is another class of drugs that's been shown to decrease neurological activity in the brain and actually cause brain atrophy. And the narcotics, what can we do instead? Dry needling. A lot of physical therapists do that. We can do massage therapy, chiropractic, Epsom salt baths, cryotherapy, especially if it's a muscle issue. So narcotic painkillers, another class of drugs that causes this damage. How about anti-seizure medications? A lot of people are dealing with seizures. They take these drugs and then they cause more neurological damage by causing that brain to atrophy. So anti-seizure, what we have in the natural world, one of the best things you can do is the ketogenic diet. Tons of research out there as well. I've talked about keto diet in the past, but basically a higher fat, lower carb diet, and a lot of research on that helping seizures. Another class of drugs, anti-Parkinson's drugs, the shaking disease that you may have seen people had. And Parkinson's research showing exercise very helpful, regular daily exercise. You just got to be careful that you're in a safe environment. And then there's another technique called deep brain stimulation that's really helpful as well. And another class of drugs that we're looking at, there's 9 different ones that we're going to be talking about today. Tricyclic Antidepressants is another class of drugs that is contributing to neurological degeneration, brain atrophy. And instead of taking those antidepressants, again, we get back to exercise. We can talk about relationships, very, very important. And then even St. John's wort, a lot of research showing St. John's wort has antidepressant effects. Crystal, are anti-anxiety medications on that? Yes, that's another class of drug that we're going to jump to. The anti-anxiety drugs is another one of those class of drugs that the research is showing is causing neurological degeneration. It's not, there's still more research coming out on that, but there's potential correlations between the benzos, that's drugs that are for insomnia and anxiety, and some of this neurological degeneration, especially that dementia. So yes, Crystal, the anxiety and insomnia drugs, the benzos, it's not official yet, but that is very much where the research is headed at this point. Antipsychotic drugs also, allergy medications, there's a bunch of these that are all the time people are taking on a daily basis, anti-allergy medications, and those are contributing to dementia, neurological degeneration, brain atrophy. Other things we can do, local, all natural, organic, raw honey is actually going to be very helpful for these allergies instead of using that allergy medication. Those bees are pollinating and they have a lot of the different types of local pollens in there, so you want to get a local raw honey. If you can find just look on Craigslist or anything like that, find somebody selling local raw honey, can be very helpful for that. Neti pots, put the water, sea salt in there, and you run that through the nasal passage, it's going to clear that out. All those allergens, all those pollens, everything are going to get stuck in there, so you've got to clear those out. Essential oils are going to be great for the allergies as well. And then the last one, the motion sickness drugs. This is another class of drugs that is contributing to dementia and neurological degeneration, brain atrophy, and research has shown ginger can be really helpful, as well as there was a really interesting study on 5-HTP and magnesium taken for a few months can almost get rid of that motion sickness. Again, the anxiety and insomnia drugs are on there as well, and that can be a huge part of the neurological degeneration. These benzos, we've heard for years that they're not constructive, but people are still getting prescribed them, and yet there is a lot of negative side effects there. So I'll post basically a sheet of a lot of the different medications as well, and get you guys that information. So look for that to pop up in the section down below. Sandy, good to see you. What if I've been on citalopram for years? Well, you better do as much as you can for your brain. You better do as much as you can to reverse these damaged effects of the medications. You know, it is what it is at this point. You know, I would suggest do whatever you can to come up with an alternative with your doctor, or natural alternatives as well. But definitely you want to make sure that you're educating yourself and making yourself aware of which of these drugs. So again, incontinence drugs, muscle relaxants, narcotic painkillers, anti-seizure medications, Parkinson's drugs, tricyclic antidepressants, antipsychotic drugs, allergy medications, motion sickness drugs, and even the anxiety and insomnia pills in the class of the benzos are also going to be contributing to that dementia. So what do? Well, you've got to get your body as healthy as possible so that you don't need to take these. Remember, all of these are just symptom reversers, symptom blockers. They're not going to actually fix the underlying why. And so, hey Gilda, good to see you out there. And so what we're looking at is we've got to fix that underlying why. That is the whole premise of functional medicine. That is why we go through every single day with patients and get to the underlying, this system is out of balance, this system's out of balance, and we just go through step by step through that process, reverse the damage that's come in, help people take as little of anything, whether it's a medication, it's a supplement, it's natural, whatever, doesn't matter. Take as little as needed to get the desired result. I don't want to just come up with, hey, here's this natural alternative to your allergy medication. That's still practicing a this for that model. That is not practicing the fix what you find model, which is what we do in the functional medicine world. So we have to be able to uncover those underlying whys. We have to be able to fix those systems that are out of balance, and then we're able to go step by step and pull people off of whether that's medications or supplements or whatever they're taking to mask the symptoms. Just like Julie said there, they don't get to the underlying source of the problem. So that's the functional medicine approach. Keep an eye out for these medications. If you or a loved one or a friend or family member, anybody is taking these medications, educate your guys' self, watch these, and you'll get a better idea of what you need to be doing to get off of them, but also to do things naturally so that you don't have to have these symptoms as well. So, all right, guys, hope that was informative there. I will post a list of everything that we know as far as the different medications that are going to be the worst for that, and we'll get you guys as educated as possible. Make it a great day, everybody. Take care.